listen to me. So Kevin, take it away.
Thank you very much, Sue, and thank you to everybody at Human Connects for giving me the opportunity to come and talk to you all. I appreciate everybody who is out there and anybody who's already bought the book. It's a real, kind of surreal to me that people are buying a book with my name on it, and I'm really happy I get to come and give you this presentation here. And just a quick note, if there isn't time for me to answer your questions at the end, you can still submit them to Sue, or I'm going to provide my email. You can also send them to me directly, and I'll make sure I get back to you and answer them over the course of the week, because I want to make sure that I answer any questions that you might have. All right. So obviously the name of my presentation, Functional Training Anatomy, an Anatomical Guide to Training. It's the same as the book. And thank you to Mary Kate Fight, who was my co-author, who really edited to make my book digestible. If you've dug into that book already, this will go perfectly as a practical guide to kind of better understand some of the things in the book. Quickly, about me, this is, if you don't know who I am, I'm a strength conditioning coach and massage therapist. I've worked at Mike Boyle Strength Conditioning for about 13 years now as a personal trainer, strength conditioning coach, working with general population clientele as well as competitive athletes ranging from 12 years old all the way up to through the professional Olympic level. I'm also a massage therapist. I have a business called Movement as Medicine, where I work as a manual therapist, helping progress clients back from chronic stiffness and discomfort back to performance and whatever activities they want to get back to doing and feeling good at. And I work as an educator doing things like this, like webinars, but also teaching certified functional strength coach courses. We have a level 1 and level 2 certification where we travel all over the world teaching coaches the systems that we use at Mike Boyle Strength Conditioning. And we also provide online education through MBSC TV, formerly Body Boyle Online, and strengthcoach.com. So now I want to get right into this because I know we got an hour and I want to fit all of this in. So to kind of understand how functional training came to me and my perspective on all this, I want to take you back and tell you my story. So we're going to go back to the beginning. It's the years probably about 2006. Yeah, about 2005, 2006. I was working at a Gold's Gym in Maynard, Massachusetts, where I grew up. Probably not where you think someone would learn about functional training, but that's where my love of strength training started. And that was my first job in a gym. I started as a front desk attendant, mainly because, as a 17, 18-year-old kid, I knew that meant I was going to get a free gym membership. And I could go and work out for free. I could make a little bit of money. And I started to learn about training, right? And so like anybody at that age who first starts to train, the way I decided how I was going to work out that day, I would open up Muscle and Fitness, Flex magazine, whatever that bodybuilding magazine was of the day, and I would just put my finger down and find the workout of the day, whether it was, what Ronnie Coleman did or Jay Cutler did. And I just did a ton of bodybuilding type exercises, right? So, leg pressing and using the pec deck and, using the leg extension, just trying to get as big and as jacked as possible. And, to no surprise to some of you probably listening to this, it didn't transfer that well to my athletic career. I got pretty big and pretty strong, but I dealt with some shoulder injuries, I dealt with some knee injuries, dealt with some hip injuries, mainly because I didn't really know what the hell I was doing in the weight room. But while I was working there was this private contractor. His name was Clark Evans, and I always shout him out because I wouldn't be here talking to you today if it wasn't for him. And I remember looking across the gym and seeing Clark do single leg squats and hang cleans and ball rollouts and single leg deadlifts and hurdle hops and hurdle jumps. And I'm thinking, I've never seen anybody train like this. All I'd ever seen was the meathead stuff that went on in Golds. Either people working on the elliptical or people using the leg press. I didn't really know much outside of that. And so I started talking to Clark because he looked athletic, he looked jacked, but he looked like an athlete. And he said, why don't you work out with me? So I worked out with Clark one day, and it crushed me. For someone who could push like 500-600 pounds on a leg press, I couldn't even do a single leg squat. I couldn't do a single leg deadlift. I certainly didn't know how to do a hang clean. I didn't know how to train like an athlete. I remember Clark saying to me, well, if you want to play sports, this is how you have to train. And at the same time, I just applied to go to UMass Amherst. Freshman year, I was going in to study kinesiology. I knew I wanted to be in fitness or physical therapy or something like that, but I obviously didn't really know what I was doing. And I asked Clark, I said, where did you learn all this stuff? Well, what the heck are you doing? And he said, oh, I just did a mentorship with this guy, Mike Boyle. And this was back in 2006. He goes, he's the strength and conditioning coach for Boston University. He used to work with the Bruins. And he has a training facility up in Woburn. And you should look into doing a mentorship or an internship. And I didn't even know where Woburn was. I grew up 40 minutes away. It might as well been another country. And I didn't even know that there were such things as like private sports performance facilities that were doing this. So I applied for an internship. I got it, and the rest is history. And that was about 2007, 2008 when I started interning here, and I'm still here now. So it's safe to say that my exposure to functional training in the model of training that we do now that I'm sharing with you here changed my life. I opened a whole new world of looking at exercise that I didn't even know existed. When I first walked into BSC, I felt like I'm home. It was a completely different world, and I saw people that were thoughtfully building programs to try to improve health and improve athletic performance. And I thought to myself, I want to try to share this with everybody. So today, I hope that I can give you a little bit of that experience, that feeling that I had when I discovered what functional training was and what it wasn't, and better understood how to build programs to best serve my clients. So let's get this question out of the way first. Functional training is a buzzword. In our industry, it's controversial for better or worse. Some people, when they hear the word functional training, they scoff and they laugh. Some people swear by it, right? And I think there's a lot of misconceptions about what the word functional training really means. And to some people, they might look at that woman balancing on the Bosu ball, and that's the first thing that they think of when they hear functional training. They think it's circus tricks on a ball, balancing on one leg, wrapping yourself around with bands, and maybe that's what you picture. Whereas, some people say, well, I have to get up and down out of a chair or off the toilet every day, so back squatting to me is functional because it transfers to me being able to do that. And then I might fall personally, in my definition, falling somewhere in the middle. Maybe this guy doing a split squat, preferably with a shirt on next time, but this is the picture I could find in the stock photos. And I think of it that it looks like strength training, but it probably looks a little bit more athletic than some of the traditional approaches to developing muscle based on strength sports like powerlifting and bodybuilding. And so when people always ask me, what is functional training? I always say it's not defined by exercises. It's defined by the goal of the athlete. And if there was one word for me to sum it up, I would say functional training is purposeful training. It means that we're selecting exercises based on the athlete, based on their goals, and based on their human anatomy. So if we want to put that in a sentence, it means functional training means we are purposefully selecting exercises to improve a specific outcome and basing those selections on the structure and the function of the human body. So that's it. It's that simple. Notice I didn't say it means single leg squats. I didn't say it means Bosu balls. I didn't say that it means, twisty cable exercises. We're not going to define it by a method or an exercise. We're going to define it by the why behind how we're selecting our exercises to improve that client. So that means we have a broad selection of exercises we can choose from based on the clientele. Too often, I think we're picking exercises based on the methods that are popular, or the exercises we see on social media, whereas all that matters is how we can best serve our clients, right? So again, when some people think about functional training, they think about things like this. Now, for the majority of people we work with, I would say this might not be a functional training choice unless you work with people like this, who work in the circus. If you had someone who had to improve the skill, the motor skill of balance on an unstable surface, maybe this would be a wise choice because it's purposeful based on that specific client's goal. Same to be said about back squatting. If you're training powerlifters or strength sport athletes, people who compete in strongman, who have to have high levels of bilateral lower body strength, a selection like a back squat might make a lot of sense, right? So again, our exercise selection is going to be determined by the people we train and their goals. Now, I could probably guess that if you're listening to this right now, and you're a personal trainer, a strength and conditioning coach, or even a physical therapist, your clientele probably looks a lot more like these three pictures than these, right? Probably a small subset of you work with circus performers who need to balance on a ball, or powerlifters or strength sport athletes. And probably more of you work with beginning at like youth athletes who are just learning how to train, like this gentleman squatting with the PVC pipe across his shoulders, or high school or collegiate athletes looking to improve performance and reduce injury, like the gentleman in the middle, or like Sharon and Jim on the far right side of your screen, who are in their 60s and 70s, who come train at our gym 3 days a week, or general population clients. The majority of people coaching are going to work with people with a low training age, competitive athletes, or gen pop clientele. And so that's going to shape our exercise selection, and that's going to shape what exercises define functional training for us. I always like this quote from Jorge Carvalho. I always go back to it. He says, your sport is not different. You just think it is. Because as coaches, and definitely as athletes, we always think that we need some sort of special intervention or some sort of special exercises to improve us. But it's really important to realize that most of us are beginners. Most of us have low training age. And most of our training interventions just need to be general to enhance our general fitness qualities as humans to help us apply them better in our sport. So I think it's important we discuss the difference between general and specific goals, because again, our intended goals and outcomes are going to define our exercise selection. Like I said, most of us are going to work with general population adult clients, low training age clientele, and team sport athletes. And that specific training outcome that we referenced for the majority of clients is very general, and that's okay. That doesn't mean that we're not special coaches. Every client is unique in their own right, but they're all going to have a lot of overlap in what their ideal outcomes are. And I always go back to the Pareto Principle or the 80-20 rule, where we realize, 20% of what we do is going to apply to 80% of our clientele, right? So the majority of our exercise selection is going to be the same, because we're all working with the same body to get towards fairly similar outcomes, albeit it might be at different volumes or intensities, right? So, this gentleman here is a professional hockey player that we work with. He has 100-pound dumbbells in each hand, and he's doing multiple reps on rear foot elevated split squat on each side. Yeah, I wouldn't give Sharon, pictured here, those dumbbells, but she's still doing split squats. Maybe it's just a lower intensity. So when I talk about the 80-20, if you look at the red versus the white, that red side of the screen, that's our 80%. Whether you're working with adult clients or young athletes or low training age clientele, that everyone who comes in generally wants to feel better. They want to have better movement quality, want less stiffness. They want to be more powerful, whether that's an athlete who says, I need to run faster, jump higher, or just an adult client who wants to improve their activities of daily living and reduce the risks for accidental falls. They want to increase their strength and their speed. They want to improve their cardiovascular fitness, either from a performance standpoint or just from a cardiovascular health standpoint. And a large amount of the population, especially Gen Pop, wants to lose body fat or improve body composition. Now, the detractors of things like functional training or like the special exercises that you see on Instagram or on YouTube or on Facebook are what fall in this white little section of the screen, the 20%, or even sometimes less than that. Things like balance-based training or working at extreme ranges of motion or accounting for anatomical abnormalities like structural issues or surgical interventions, unique rehab situations or skill-specific training as it applies to a sport or some unique activity, or even max effort bilateral strength, things that are based in powerlifting. Now, all those things are necessary with certain clientele, but it's not in the majority. It's the minority of interventions that we need to think about. The problem is, in our industry, we tend to overly focus on these unique outlier situations at the cost of all these things on the other side in the 80%. And I always caution coaches not to get caught up in the minors. I said, you're majoring in the minors, focus on the 80%, and you're going to better serve the clientele that you work with. And at the end of the day, that's the most important thing. So this is our formula. This is our recipe for functional training. And I'll talk about this on the next slide. I say it's a recipe, not a menu. It's not just one thing. I know as strength and conditioning coaches, we always focus on strength. Some of us just even call ourselves strength coaches. But in reality, we're mobility, warm-up, power, strength, and conditioning coaches. No intervention, no program is complete without checking all of these boxes, because we're not just trying to get people strong. We're not just trying to get people conditioned. We want them to feel better. We want them to stay healthy. We want them to be powerful. We want them to be mobile, in addition to being strong and being conditioned. So when we're thinking about programming, we want to make sure that we check every single one of these boxes to enhance that overall outcome. So say functional training is a recipe, not a menu. You can't pick what you want, right? And when we train ourselves, if all of you probably exercise listening to this, you tend to just want to do the things you like. You don't want to do the mobility work, or you don't want to do the warm-up, or you don't want to pick the exercises you're not good at because it's not fun. But our job isn't necessarily always to provide fun, it's to provide effective training, right? So you can't just pick what you want a la carte. You got to go through all the steps. So to pull a little piece out of the book that I really wanted to hammer home, an athlete who is strong but lacks mobility is at risk for muscle strains and joint damage. An athlete who is extremely mobile but is limited in strength will be overpowered by opponents or lack the ability to produce the adequate levels of force. An athlete who is powerful but lacks aerobic conditioning will not be able to maintain power output over time and will fatigue prematurely. So a comprehensive, well-rounded functional training program should include all of the following components and not just one. Mobility training to optimize tissue extensibility and joint health. Movement preparation drills to improve movement quality and efficiency. Unilateral, bilateral, and multi-directional power exercises to develop deceleration skills and power expression. Full body strength exercises that address knee dominant, hip dominant, pushing, pulling, and core strengthening movement patterns and challenge the strength and stability of the body in multiple movement planes. And then energy system development that addresses specific metabolic demands of the sport, and cardiovascular health for the general population client. So if we're able to define what is functional training, then now we need to define what is functional anatomy. And I tried to pull out some pictures from the book to kind of demonstrate what I mean by functional anatomy. So Craig is a coach for us here, and that's his picture, and that's the drawing that from the book that we drew off of that. And when we go further, you're going to see why these things are important. So when many of us first learned anatomy, when you first took your anatomy course, whether that was in high school or in college, we took a gross anatomy course, right? And this is really important. This is the foundation of how we just learn about muscles, and we learn about organs, and we learn about the human body. And in respect to orthopedic health and muscles and joints and things like that, what do we first learn? We learn the muscle names, obviously. We learn origins and insertions, where they attach at different joints and how they interact with one another. We learned about the pennation of the muscle, like the angle of the fibers and how they're aligned and how they're affixed. We learned about innervation, what nerves innervate each muscle. We learned about articulation, how do they align in chains and attach. And then we learned about relative to position to one another and size. So that gives us basic anatomy 101. So we start to learn the fundamentals of how all this anatomy pieces together on the human body. And that's a great place to start. But what I always stress is that we need to move beyond gross anatomy if we want to have effective application in a practical setting for our athletes and for our clients. So we need to understand what functional anatomy is and how is that one step beyond gross anatomy from a practical application standpoint. So for me, the way I would define functional anatomy is it takes those things that we just spoke about and then applies the ideas of muscle actions, planes of motion, and body positions to affect how the body functions in space, right? Because all that matters from an anatomical standpoint for us as coaches is how can we select better exercises and provide better interventions to our clients. If we only go based off the gross anatomy, it's not going to tell us much about our body and how it functions in respect to gravity and with certain muscle actions and activities and how that might affect our end goal activity that we're trying to improve. So again, actions, planes, and positions are going to be the factors that are going to help shape our functional anatomy understanding. So what do actions tell us, right? Actions tell us in this single leg squat down the bottom, in this example, what muscles are acting concentrically, what muscles are acting eccentrically, and which ones are functioning isometrically. And of those, which one is the prime mover, which is the agonist, which is the antagonist, which is the synergist, and which is the stabilizer, right? So in this example here, we have a couple muscles working concentrically, right? We have a quadricep functioning concentrically. We have a glute functioning concentrically. Whereas at the same time, we have a hamstring functioning eccentrically as an antagonist, right? Fighting against the quadricep. And then we have our synergists and our stabilizers helping to maintain this function. So we have our stabilizers, our frontal plane muscles, like our glute med and our adductor, helping center ourselves over our femur as we go up and down, right? And so it's easy to understand how understanding actions is directly going to affect understanding our planes of motion, right? What planes of motion are these muscles working in? We know that the quadricep is primarily a sagittal plane muscle. It's going to work in the sagittal plane to flex and extend the knee. We're going to have some of the fibers of the glute maximus helping to extend the hip, also working in the sagittal plane. But typically our synergists, our stabilizers, are going to be working in the other planes, the transverse and the frontal plane. And for sports especially, where we're moving in a multiplanar environment, we're not just moving up and down, we're moving side to side when we're rotating. It's important to understand the development of our transverse and frontal plane muscles, right? So while this gentleman here is doing the single leg squat in the picture below, our adductors and glute meds are stabilizing our pelvis and our femur in the transverse and frontal plane, as well as our obliques, to stay stacked over our femur. And those are going to be the muscles not only to help us do the exercise, but in the field of play, help to stabilize in our femur, our femur and our pelvis against frontal plane injuries, things like an ACL tear, right? So that's why exercise selection, things like a single leg squat, are so valuable. And then finally, how do positions affect how these muscles work? Because muscles are just slaves to positions. They're kind of dumb, right? Muscles don't have a brain. They just do what our brain tells them to do. And depending on the positions that our joints are in, they will affect how those muscles can function, right? So with Joe, if he's perfectly aligned doing that single leg squat there with his head over his knee, his adductor can work well, his glute med can work well, and his glute max can work well. Whereas if he's rotated outwards and side bent and he's not stabilizing well, all those muscles are not in a good position to contract because they're either overly lengthened or overly shortened. And we're going to talk about this in a little bit more in depth in the next coming slides. So it's important to understand what muscles are working, because then we can think about our end goal activity. What are we trying to improve? And select our exercises more effectively. So again, like I said here, we kind of just went over this, but as you can see, his quadriceps and glutes are going to help assist in creating this movement in the sagittal plane, whereas his hamstrings and adductor magnus and glute medius are going to assist him in the frontal transverse plane. And we just did this, so I want to just move on to here. Here we go. So we talked about positions and orientations. We said position affects an athlete's ability to perform, right? So a real base example that's going to help you understand this better is when we're in this anterior tilt of this open scissors posture, as we sometimes call it, where the ribs are up and the low back is contracted and shortened. It eccentrically lengthens and stretches the abs, and it eccentrically lengthens and stretches out the hamstrings. Opposingly, it shortens the lumbar paraspinals and it shortens the hip flexors. Now, none of these things are inherently bad, but they could be more or less efficient positions to affect how our muscles work. When muscles are overly lengthened, they don't have much of an ability to contract, right? This makes a lot of sense. If I had you stick your arm out straight and try to curl weight forward like a bicep curl, it's going to be a lot harder than if you're starting in the midsection, right? Muscles function best when they're at mid contraction length as opposed to being overly shortened or overly lengthened. And when muscles are overly shortened, they tend to feel tight. They tend to have greater levels of tonicity. Sometimes that's when people tell you, oh, my hip flexors feel tight or my low back feels tight. So this is going to affect how we coach exercises and what positions we put people into to have the muscles work most effectively. And one thing I want to touch on is the difference between global planar movement and local planar forces, because this is something that I always get questions on from people at our courses or our interns. And you might look at, this is my friend Nick here doing a rear foot elevated split squat. And if you watch him do that exercise, he primarily moves up and down and forwards and backwards. So if you looked at him, you would say, well, this exercise is a sagittal plane exercise. He's moving almost entirely in the sagittal plane, and you would be correct. The global plane of movement in this exercise is within the sagittal plane. However, for him to do a unilateral exercise correctly without falling over or side bending or rotating, he has to balance out frontal and transverse plane forces eccentrically and isometrically to maintain movement in the sagittal plane. So I always say, like, watch a beginner try to do a single leg squat or a split squat, and they're going to wobble all over the place. And that's not necessarily because they're just weak. It's because they just haven't developed the stability strength, so you could say they're weak, in the frontal and transverse plane muscles, like the glute med or the adductor, that are going to help him rotate his pelvis over his femur, maintain his rib cage over his pelvis, maintain his knee over his tibia, maintain his tibia over his foot, so he doesn't wobble side to side. So although a motion in exercise might be primarily in one plane, if it's a unilateral exercise in nature especially, there's going to be multiplanar forces that we have to account for. And that's why unilateral exercise is so valuable in our mind here at Mike Boyle Strength and Conditioning. And how do we do that? How do we maintain multiplanar stability? Is using these anterior and posterior oblique systems. It's important to realize the human body was evolved to function unilaterally. We run, we jump, and we throw in these contralateral patterns, right? If you skip or run or jump, it's always opposite arm, opposite leg, right? When you throw, you step your opposite arm, you throw with your rear arm. And so we should think about providing training interventions that reflect our evolutionary structure. There really are no sports that are done primarily bilaterally, except rowing. I couldn't think of another one other than rowing that is bilateral in nature primarily. So we want to account for the way our body is designed, looking at these spiral systems that we have, thinking about selecting exercises that develop them so they can more effectively transfer not just to sport, but to our everyday activity. Because our entire life, as we move through it on a daily basis, is done primarily one leg or one arm at a time. So I want to dive right into the practical piece of this. And these are the 4 guiding questions I want you to think about when it comes to exercise selection. And we're going to kind of call back to these as we go through this presentation. So how do we use functional anatomy to select better exercise? Ask yourself, when we're picking an exercise, we're auditing our program, we're building it. Am I loading the appropriate tissues? Am I loading the appropriate joint positions? Am I addressing the specific planes and actions of the target activity? And can I load the volume, intensity, and speed that I want to get the training effect I want? So we want to ask ourselves these questions to ask ourselves, are we selecting the best exercise intervention possible? Or am I just going off the traditional thought process or choosing things that I like? And we want to make sure that we're answering these questions yes. Okay, so let's start with the lower body, and we're going to work our way through lower body and some core training examples where we're going to apply some of these principles to actual program design. So let's start with a hamstring strain. Probably one of the most common things I find myself discussing with people. Hamstring strains are the most common lower body, the most common soft tissue injury in all of sports. So it's something that leaves a lot of strength coaches, personal trainers, and physios scratching their heads, and it leaves a lot of athletes frustrated. So if we can better serve this answer, then let's try to do that here. So let's first talk about what the hamstrings do with respect to running and gait. So what does the hamstring do? It has 3 main jobs. It concentrically assists in hip extension. It eccentrically decelerates knee extension, like shown in the picture here, as we're coming through about to hit mid stance. The hamstring's main job is to slow down the lower leg from coming forward. And it isometrically controls sagittal plane motion of the pelvis, anterior and posterior tilt. Now notice I didn't say anything about concentrically flexing the knee. And that's usually the first thing we learn in a gross anatomy class is, oh, a hamstring is a knee flexor. And on a table, on a cadaver, that's 100% true. But when it comes to gait and running, that's really not true. When they look at the science of what a hamstring does during running, it minimally contributes to active knee flexion concentrically. And the truth is, when that heel comes up to your butt, that's really just a side effect of active hip flexion and intersegmental dynamics where the leg swings backwards. Its main 3 jobs in gait, again, are to assist hip extension, decelerate the knee, and control position of the pelvis. So we want to make sure we keep that in mind when we get to the exercise selection portion in just 1 second. So remember that. Now, let's try to break down a hamstring strain. What typically happens in a hamstring strain, right? Of the muscles in the hamstring, there's the semimembranous, semitendinous, the biceps femoris long head, and the biceps femoris short head. And the biceps femoris long head is the most commonly injured of the four hamstrings, and that's by a long shot. It's almost 80% of hamstring strains happen in the long head of the biceps femoris. Most commonly, it happens during the terminal swing phase of gait. So if you look at this little guy running across the screen here, that would be in number 1 and number 7, right before heel strike is normally when that hamstring blows up. And in fact, the majority of them happen before the foot even hits the ground, and that's fascinating. Most of these hamstring strains happen before the foot even strikes. And what you want to think about what a hamstring does. You've got 3 jobs that it has to do over the course of a gait cycle, right? It's slowing down the lower leg, it's maintaining that position of the pelvis isometrically, and then it's about to rapidly help extend that hip along with the glute, right? And so it's got a lot of jobs to do. And if its muscles or synergists that are helping them do these things aren't doing their job effectively, it puts more load onto that hamstring to do it, right? So I always think about, like, if I show up to work one day and I got 2 other coworkers with me, and we're about to coach a large group of athletes, and I show up to work and those other 2 coaches don't show up, by the end of that day, I'm going to be sore, I'm going to be tired, and I'm probably going to be grumpy. And that's a hamstring. When there are glutes that don't work well, when there's obliques that don't work well, and that hamstring has to take the job of hip extension and pelvis stabilization, along with slowing down the knee all by itself, it gets overworked. And over time, there's a cumulative effect that usually leads to either a chronic or an acute hamstring strain. And that's what we find when we look at it. When there's when all the other muscles aren't working along with them, that's when we run into trouble. And that further should stress the fact why we shouldn't choose isolated exercises, because our body works in an integrated fashion in a functional kinetic chain where all of these muscles have to work together to achieve a goal most efficiently, right? And when they look at athletes who suffer hamstring strains consistently, they follow the track of athletes over the season. What they found, the ones that had hamstring strains had increased hip flexion and anterior tilt when compared to those that didn't. So their pelvis was more oriented forward, right? So their hamstring wasn't doing a great job pulling that pelvis back in a posterior tilt. They had increased medial knee rotation as a result of that anterior tilt. And they had reduced bicep femoris activity when compared to the glute on the same side. So that hamstring was weak as a result of the poor positioning of that pelvis, right? So we go back to how does position affect function? Well, if a hamstring is tilted forward, there's an increased eccentric strain on that hamstring. It's going to have a harder time pulling that pelvis back, and it's going to put more eccentric tone in there, making it harder to concentrically contract for rapid hip extension. So again, like I said, position matters. Athletes who present in this chronic tilt position are going to have a higher instance of hamstring strains due to the link tension relationships of the surrounding muscles. If those eccentrically loaded abs on the front side can't contract well to pair up the rib cage and pelvis, right? Like I said, there's other muscles that have to work in the functional kinetic chain. Then it's going to negatively affect how that hamstring functions. It's going to place more stress onto that hamstring. So I would say not all leg curls are created equal. Typically, when you hear people train hamstrings, this is what they think about: leg curl variations, either prone or seated, and they're just isolated. You're not getting anything besides concentric and maybe a little bit of the eccentric strain on the hamstrings, but you're not getting any hip extension, and you're certainly not training the other muscles involved in the kinetic chain, like the obliques and the glutes, to help work as a unit as they should. Whereas if you look at Brendan on the far side of the screen here, doing a slide board leg curl or a val slide leg curl, what does he have to do this well? He's going to bridge his hips, so he's getting active extension with the glutes. He's maintaining core stability, so it's not sticking his belly into the air, and he's eccentrically straining the hamstrings. So this is where we're typically going to start with the athletes, because it checks those boxes. What did we say the hamstring has to do during gait? It has to extend the hip. He's extending the hip. It has to maintain pelvic position with the abdominals. He's doing that. And it has to eccentrically control extension of the knee. And so simple exercise selections like this can make a huge difference in the ability of our athletes to function and prevent soft tissue injuries like this. Furthermore, exercises like a single leg deadlift, where there's going to be high amounts of eccentric strain and demand for active hip extension with the glutes and the hamstrings, are going to be better choices than isolated and machine-based exercises or even bilateral versions of the deadlift, right? So again, These are the things we're making sure we check off when it comes to training the hamstring effectively: eccentric knee extension, concentric hip extension, and isometric control of the pelvis. Additionally, what was the last question I said that we want a lot of our exercise if I go forward? Can I load the volume, intensity, and speed that I want? So let's go back to here. The only thing I couldn't say yes to in those two exercises, the deadlift and the leg curl, are the speed and intensity. If we're trying to prevent hamstring strains, we have to work at the same speed at which we're going to train and compete. So that means we got to run. And I know vaccines are a popular topic right now, but I've always said sprinting is a hamstring strain vaccine. If you're consistently running fast, when the athlete gets out on the field of play, they're not going to be shocked by the speed and intensity that they run at. Very often, when we see athletes that have hamstring strains, they've been running low to moderate or 75% speed, and they never run at high speed. You need to have specificity for the task in hand. And so the only way we can get high velocity hip extension that represents the speed that we're going to see in sport is by sprinting. The fastest thing you're going to do in the weight room might be a couple meters per second, whereas that's a 10-yard sprint. You see he just ran a 109. That's like 8-9 meters per second. There's nothing you can do in the weight room to represent the speeds that you function at out of the field of play. So that component of speed and intensity is really important. So if you want to look at a hamstring prevention formula, you look at these exercises out of the book right here, things like single leg deadlift, things like slide board leg curl, hip extension, and sprinting are going to be the exercise choices we want to make. Moving along to single leg training. Why do we train on one leg? And if you're familiar with what we do at Mike Boyle Strength Conditioning, you know we primarily train the lower body unilaterally. Like I said, we're made to function unilaterally, and the anatomy makes it pretty clear when you look at these anterior and lateral subsystems in the body, how our adductors and external obliques work together to stabilize the pelvis, how our adductors, our glute med, and our QL work to stabilize the pelvis. These are going to be the things that help us maintain frontal and transverse plane stability that are going to be neglected if we're training primarily bilaterally, right? And when you look at us changing directions in sports, it's all these frontal and transverse plane muscles that are working in addition with our sagittal plane prime movers to help us change directions efficiently and safely. So again, traditional training approaches are overly influenced by our traditional strength sports because that's where the weight room started in things like powerlifting and bodybuilding. They're primarily sagittal and bilateral, and it's not to say they're not valuable. They're very valuable in teaching fundamentals and basic strength, introducing someone to the weight room, but they're overly focused on sagittal plane activity. The reason these are valuable for these traditional strength sports, I mean, obviously for powerlifting, these are the activities that they compete in. So the specificity is very high. It would make a lot of sense for them to back squat and not as much sense for them to single leg squat. For bodybuilding, the reason they tend to prefer machine or bilateral based exercises is because there's less variability in movement. So you can get more volume to produce more hypertrophy, right? So again, better choices for those activities. But the problem is those aren't the activities we're training most of our clients for, right? We're training our clients for sports and for life. Better exercise selections are typically going to be unilateral in nature. They're going to challenge us in the frontal and transverse plane. They're going to have higher levels of carryover. Everything changes on one leg. One benefit is that there's less spinal loading. For someone like Lisa here, who's about almost 60 years old, I'm able to get a stimulatory effect in her legs without putting a large amount of weight on her spine, which she might not tolerate at a more advanced age. Again, local and frontal transverse stability, like a kid like Kaysen or Jimmy here. And I want to see that position dictates function. So if I go back to Kaysen doing the single leg squat, you see his pelvis is over his femur is over his tibia, and his tibia is over his foot right here in this next video. And that's going to ensure that he's developing the stability in the planes that we want because he's nice and stacked in a good position. He's having to work in those multiplanar muscles to do that effectively. One more thing that we've kind of realized recently is also that we can get the same or greater training effect with less external load. So Alex Natera is a rugby strength coach and a researcher out of Australia. And what they did is they looked at the force generation using force plates and rate of force development in single leg squatting and bilateral squatting. And what they found is they can get equal or greater lower body loading with less total load. And if you're thinking about training athletes, if we have less total load, there's less cost to the exercise, which means there's less fatigue systemically, less soreness. So you can probably train more frequently, and it's going to less negatively affect their weekly competition or training that they also have to do for sport practice. And as that goes for Gen Pop clients, they're generally just going to feel better. So what they found is when you account for the extra limb and the weight of the body weight, that you can get with a 50% body weight single leg squat. So if I was doing a single leg squat, I weigh 220 pounds. If I was holding 110 pounds at my chest and doing a single leg squat, that is the equivalent force generation of a double body weight back squat. So for me, a 110 pound single leg squat would be the equivalent of a 440 pound back squat done for 5 reps on either side. Now you tell me which one is going to be more costly from an orthopedic and nervous system stress standpoint. I would always choose the more efficient strategy, so there's less cost. We always want to think about cost of training and doing business, because training is stress, just like anything else. And what he found was, there's a great quote from the research, is unilateral squats with the same external load per leg produced greater peak vertical ground reaction forces than bilateral squats, as well as higher barbell velocity, which is associated with strength development and rate of force development, respectively. So I'm always looking for efficiency in the weight room. And then on top of that, that can be transferred directly over to plyometrics. People always ask me, they always ask you the traditional question, if there was one exercise you could do, if you could only do one, what would it be? And mine is single leg hopping, especially for athletes. I think it's the most valuable tool we have to improve power as well as reduce lower body injuries, because there's pretty much nothing else you can do in the weight room that can increase unilateral power, improve eccentric landing strength and deceleration, and also develop multiplanar pelvic, hip, knee, and ankle and foot stability. You're not going to find anything else. So for us, if we really want to think about preventing or reducing injuries, combining the power of single leg training with single leg plyometrics, which, like I said, it's the entire program, not just one piece. I really think we have the ultimate duo to improve sports performance as well as reduce injuries. And similarly, from a paper that looked at the comparison of unilateral and bilateral training, what they found was that unilateral plyometrics improved bilateral jumping, but bilateral plyometrics did not improve unilateral jumping. And that's something that's really important to think about. Especially right now with COVID, we've had to really parse down our training program at MBSC because we only have an hour and there's more spacing. So we've really gone to all unilateral plyometrics because, I mean, if you take the excerpt from the research study, unilateral plyometric training was more effective increasing both single leg and double leg jumping performance, isometric leg press maximal force, and rate of force development when compared to bilateral training. So again, let's go back through our 4 questions, right? Doing things like split squats and single leg deadlifts. Am I loading the appropriate tissues for sport, for sprinting, for jumping, for deceleration? Yeah, I'm training the glutes, hamstrings, and quads. I'm working the frontal and transverse plane muscles and adductors and glutes that we don't necessarily get in a bilateral approach. Am I loading the appropriate joint positions? Yep, an acceleration position or a single leg stance. I'm addressing the planes and actions like I touched before, and volume, intensity, speed. You have high loading potential very clearly in this single leg training. If I go back to this lady here, I believe, where is she? Emily. I believe that's a 65-pound bar. That's 30 pounds on each side. So let's see, 60 plus 120 plus another 5. That's 135 pounds on each leg for 5 reps on a single leg deadlift. And she's probably about 135-pound individual. So not bad on one leg. So, and like I said, plyometrics, high rate of force development. Moving along into the trunk, I want to make sure I stay on schedule for all of you here. Let's talk about core training. So how should we look at core training? This is a controversial topic. And in fact, I like to call it trunk training more than core training. And I'm going to talk about our approach, and then more importantly, how do we apply this, especially to rotational sports. So I like calling it trunk as opposed to core, because I think sometimes we just focus on the stuff in the front, right? You think about the model muscles, the rectus abdominis, the 6-pack, and the obliques, and that stuff's really, really important. But it's also equally important to think about the stuff that's underneath, like the transverse abdominis and the pelvic floor and the diaphragm and the multifidus, as well as the lats, the serratus, the erector spinae, all the stuff on the backside as well. Because all of this is going to help us transfer force effectively between the upper and lower body and create stiffness around the spine, which is really what the core muscles are meant to do. So we want to keep that in mind when we're selecting exercises. We're also thinking about the muscles underneath and the muscles on the backside. So what do core muscles actually do? Opposed to what you often see when you talk about core training, you see lots of crunching and twisting and moving all over the place. But if you think about what these trunk muscles actually do in a functional manner, in a functional setting, they're made to brace and buttress against outside forces. They're made to create stiffness and to effectively transfer force between the lower and upper body. They're isometric and eccentric controllers of trunk motion rather than dynamic creators of trunk motion. Can they dynamically create flexion, extension, rotation? Yes, of course. But if you think about our activities, they're typically meant to help transfer force from the leg to the hands. When you're thinking about sports and life, most of the time, all of our force is generated through the ground. If you can't push into the ground, you can't really do very much. But then we're supposed to try to transfer that up to our hands as opposed to rapidly changing direction with those muscles, right? Going back to this diagram, you're probably going to be sick of it. Again, position dictates function. So to make these muscles work effectively, we want to think about better aligning them, getting nice alignment between our rib cage and pelvis, as opposed to being in a big position of extension or a big position of flexion. You want to think about keeping our rib cage and our pelvis stacked right on top of one another for optimal function. Try to pull some more pictures of the book to demonstrate what I'm talking about. If you look at these pictures here, you look at the woman swinging the tennis racket. She's nice and stacked. Her rib cage is over her pelvis. She's able to effectively transfer that force from the ground to her upper body, to her hand, to the racket, and to the ball. And to do that, we want to think about selecting exercises that train that, right? So if I look at Joe on the top left there doing a ball rollout, he's really working on fighting extension. That's an anti-extension exercise. Or my wife Ariel doing the chop and lift down the bottom. Again, maintaining a stack in her pelvis and rib cage and resisting rotation while bringing that cable against her. Those are going to be exercises that most effectively transfer to our end goal activity. And that's the type of stuff we call anti-core training, right? And we call it anti-core training because typically we're trying to resist motion as opposed to create it. As you see Joe doing this farmer walk or this suitcase carry, he's resisting the weight pulling him sideways. So he's effectively working those obliques and lats and even the glutes to try to maintain that tall stacked position as an isometric and eccentric controller of trunk and pelvis motion. And so when I build programs, the number one thing I try to think of first is developing sagittal plane competency and developing this relationship, trying to get the rib cage over the pelvis as opposed to this position of extension shown here or a position of flexion. And then after doing that, focusing on developing core strength and stability in multiple planes, right? Again, if they're not in a good position, none of this stuff matters. Anti-rotation, anti-lateral flexion isn't going to be effective if we're not in a good relative position in a sagittal plane first. So I always start with sagittal plane competency first and then try to progress from there. So again, sagittal plane competency, what does that mean? Anti-extension exercise, doing things like front planks and ball rollouts to get good link tension relationships to the pelvis. So I'm doing things like front planks, ball rollouts, body saws, things to work that anterior core musculature before progressing towards frontal and transverse plane muscles, doing things like anti-rotations and chops and lifts to fight and develop stability in the transverse and frontal plane. Then going from there, we want to talk about practically how can we best prepare our athletes for rotational sports, because typically that's the money. If we think about most sports, every sport we do is rotational. Our life is rotational. Walking is a rotational activity, running is a rotational activity, but most of these sports we watch, basketball, baseball, football, golf, you name it, are primarily rotational in nature, whether it's running or swinging some sort of object. So let's talk about what happens in rotational sports. Believe it or not, rotational strength and power is much less about producing spinal motion and much more about controlling it. If you look at either of these pictures, you see Mike Tyson throwing this hook, or you see Escobar here swinging the bat, you can see pretty clearly their hips and shoulders are actually aligned. There's not a lot of disassociation between their hips and their trunk, right? Like Mike is very squared up as he's landing that punch. And the guy swinging the bat here is very lined up. You can see the line on his pants going right up to his shoulder. Because any of these rotational sports, you don't want to have a huge amount of disassociation between the shoulders and the hips, because that's how we're going to transfer power, by keeping those things relatively linked together, creating stiffness through the midsection, so we can impart that power that starts on the ground and put it into the hands, or put it into the bat, or put it into the ball. So there's heavy impulse forces with relatively small amounts of motion. It's really interesting. If you look at studies of golfers, you find in elite golfers, there's very strong coupling of hip and lumbar rotation. There's very little actual difference in hip and shoulder rotation. And when they find golfers who exhibit higher levels of back pain and higher levels of lumbar rotation, they find it's because they limit hip mobility, because so their hips don't rotate well. So they have to make up for that in the kinetic chain somewhere else. And so again, it goes to stress the fact that, again, training is a recipe, not a menu. Being strong and powerful but not moving well is going to limit our ability to produce force. And if you look at Tiger Woods here, although at the top of his backswing, he has a lot of thoracic rotation, you see as he comes down into the ball, his shoulders and hips link up and follow all the way through his follow through, because that's how he's most effectively going to be able to produce force. And I found this video, I really like it because it shows the amount of disassociation and side bending at the thoracic spine, but not a lot in actual rotation. So you see this guy wind up, a lot of thoracic rotation, he comes down, he's together, and he side bends as he follows through, and his hips and shoulders are together. So the largest amount of disassociation that actually happens isn't in rotation, like you typically see people training for rotational sports, but in side bending within the thoracic spine. Going to, again, stress the importance of developing lateral flexion stability with things like side planks and suitcase carries, so you can control that motion most effectively. So again, this is the typical way you see a lot of people train core strength or rotational strength. And I always try to impart to people that this is probably not that effective, because that's not how we function in sports. We never really function a rotating thorax on a fixed pelvis or a rotating pelvis on a fixed thorax. They typically are going to move together, and we're going to be transferring that rotation from our hips into our hands, and not in opposing segments on top of one another. So if we want to talk about developing rotational strength and power, we want to start with sagittal plane strength, especially in those torso muscles, anti-extension strength, then work towards transverse and frontal plane core strength, things like suitcase carries and farmer carries and anti-rotation presses and chops and lifts, and then connect that to power so we can work at the intensities and speeds that we want, right? So sagittal plane core strength, anti-extension strength, things like ball rollouts. You can see I'm staying nice and stacked. There's no disassociation between my rib cage and my pelvis. They're all moving together here, and I'm resisting that extension force, right? Lateral flexion, anti-lateral flexion strength here. You can see I have my friend Yasin here doing a side plank. He's resisting the urge to side bend. He's developing that oblique stability so he can control side bending as opposed to actually creating it. Active rotation and anti-rotation strength. Again, I'm not getting a lot of motion, but I'm creating rotational torque by maintaining a neutral position while pushing that stick into the wall as hard as I can. And then anti-rotation strength by things like what this is called a pal-off press or an anti-rotation press, where I'm resisting the urge to rotate sideways as I press that cable out in front of me and don't let it pull me to the side. And here's a throwback of me when I was probably 21 years old, working here a long time ago, doing things like a push-pull drill to resist rotation, right? So again, you're not seeing me do a lot of twisty exercises or crunches. We're trying to lock in that position and develop those muscles as eccentric and isometric controllers of trunk motion. And finally, things like chop and lift. Again, you see Elise here doing this, resisting rotation and maintaining rotation through her cervical and thoracic spine, but not moving her shoulders and head. So Lisa's doing a really good job right there, maintaining her rib cage over her pelvis. And then ultimately, we want to connect this to our sporting activity by moving in the velocities that we're looking for in sports. So I do all this stuff with my baseball players, like this kid here, this collegiate pitcher. But then I actually have to start to move at the speeds I want as well. So it's important, again, like I said, functional training is a recipe, not a menu. You have to do med ball work as well. And you have to throw and jump and hop and bound, not just lift the weights, because we're not going to get the contraction speeds we want to carry it over to sport. Now, you might have listened to all this and said, but I like squats and curls. Those aren't things that you think I should necessarily do. That doesn't mean they're bad. It doesn't mean isolated or bilateral or bodybuilding influences exercises are bad. But every exercise that we choose exists on a spectrum of specificity and carry over to goal activities. And we want to understand why we're selecting certain exercises. If you say, hey, I just want my arms to be bigger because the summer's coming and I want to look good at the beach, that's great. I do curls too. Just don't think that that's going to have the greatest amount of carryover to shoulder strength or arm strength as it relates to sports and life. This is the 20%. This is that stuff in that white little corner of the slide that I showed before. That's extra. That's the cherry on top. That's not the meat and potatoes. And too often I see people building programs around the cherry on top and not the meat and potatoes and the vegetables. You got to have your meat and potatoes and vegetables if you want to have dessert. And so when we're looking at programs, it's not that these things are bad. It's not that they're necessarily harmful. They're just not necessarily efficient and effective if we're trying to get people to move better, feel better, and perform at their very, very best. And so remember, everything exists on a spectrum of specificity and carry over to the end goal for the client. And the number one thing is to make the client perform as effectively as possible and feel as great as possible. So again, it depends. That's the old cop-out answer. People ask me what exercise to choose. They ask me what functional training means. It really depends on the goal activity. And you want to make sure you're selecting exercises based on that. And again, go back and audit yourself with these 4 questions. Am I loading the appropriate tissues? Am I loading the appropriate joint positions? And am I addressing the specific planes and actions that I want? And can I load them at the volume, intensity, speed that I want? If you can do those, then you're going to have a pretty solid program. But I think you need to go through and audit the programs that you build to understand, am I selecting exercises based on what I like or what I think is cool, or am I selecting exercises based on the best outcome possible? Here's my, I just want to go back to the slide real quick. I know we're coming right up against 2:30 here. I'm actually proud of myself for fitting it in an hour. That's my email. If you don't get a chance to get your question in here, which I don't think you will, you can send them to me. I'd be happy to answer them. That gives me content and content to answer on social media as well, and I'll send it to you. That's where you can find most of my training information at Movement is Medicine on Instagram. MBSC TV and strengthcoach.com are going to be our online educational resources. MBSC TV is like a streaming service like Netflix for coaches. Strengthcoach.com is a written and forum site. And Certified FSC is where you can find me in person for seminars all around the world and online. And please, if you don't have the book, go pick it up. You can get it right from the Human Kinetics website. Go there first before you go to Amazon. That's probably the best choice. All right. So thank you all very much. And Sue, I think you're here to moderate as I come into the last minute here.
Thanks so much, Kevin. It was a great presentation. There are a couple of questions. I don't know if you want to, if you have time, or should we just have people?
I have time. I can answer them. Yeah.
Okay. One of them that struck me was, what's the best way to incorporate functional training into a program for a client whose goals are primarily aesthetic, or should we even try to do so?
Yeah, okay, absolutely. So it's important to realize with aesthetic goals, sometimes we get overly caught up thinking about training as a means to improve aesthetic outcome. Usually aesthetic means they want to lower their body fat, improve their body composition. So the number one thing with any aesthetic goal or body comp client that I talk with is it has to be nutrition. Trust me, I've been training for years, and unless my nutrition's intact, I don't necessarily have the body composition that I want. So things like food logging, nutritional guidance comes first. So actually, when I have aesthetic goals with clients with aesthetic goals, the first thing I do before we even touch the foam roller, before we warm up, we go through the food log. And even if that takes 20 minutes to go back through, that's the most important thing. You have to center it and frame it to them as that being the most important thing, because you can train till the cows come home, but if you don't eat well, you don't necessarily get the body composition you want. Now, then that could also be from a hypertrophy standpoint. If they're not eating enough, or they're not eating enough protein, then they can train all they want. They're not going to get the goals they want. So again, whether it's weight loss or muscle gain, nutrition has to be centered first and foremost. Outside of that, volume of training is going to play the biggest part. And what you're going to find is that, hypertrophy is a myth in that a lot of the stuff that's taught about hypertrophy and muscle mass is strongly influenced by bodybuilding, which unfortunately is strongly influenced by performance enhancing drug use, right? So some people are going to react really well to volume and some people aren't. Not everybody can go on like the high volume program and feel good. So with each client, you got to kind of find out like what do they respond best to, and probably a little bit more volume for most people is going to improve hypertrophy. But I don't think your exercise selection has to train. If it's a general population clientele who just wants to look at it and they're not necessarily trying to be a bodybuilder per se, you can typically get the aesthetic gains that they want with a basic functional training program. Like I have a lot of people here who look pretty good. Just based on the program that we use, we might just moderate the volume or intensity a little bit. We might do a little bit more volume on some exercises to enhance hypertrophy for those clients. Whereas if someone's a strength-focused client, I might do a little bit more intensity and a little bit less volume, if that makes sense.
Yep. These are kind of related. I'm gonna, anyway, what's the best exercise in your opinion to help with balance in an older adult? And also, do you change your strategy with older adults where balance is an issue? You had mentioned that balance training is about 20%.
Yeah, so it's,
yeah,
this is a great question. So I actually just had a couple that I just trained literally right before this. Stu and Nancy, they see me twice a week there. He just turned 79, she's 78. And I've been training them for a long time. And so we have if you look at our program, it looks a lot like our athletes program, although the intensity is down significantly. So we do split squats, we do single leg deadlifts, we do single leg squats. And so those are, lots of times balance is a function of hip stability. It's not always vestibular in nature, in that sometimes the reason people can't stay stable on one leg is because they don't have the frontal and transverse plane stability in their hip. So for me, single leg training comes first. I do a little bit of beam walking with them, where I actually have these orange balance beams, right? And they're about, I think they're probably about 6 inches wide. And I can buy them from Perform Better. And I line a bunch of them up, probably about 20 yards worth, and I'll have them walk down and back on the balance beam. So I'll put it into a circuit. So I'll have them throw a med ball, I'll have them do some skipping for some power generation that's lower impact. And then I'll have them do some beam walking back and forth. So they have to kind of focus on where they put their feet. So that's probably the extent of the true like balance type work I do. So it is a pretty minimal part, but it actually has a pretty big impact. And then I think the biggest impact I get is doing single leg training. And to your question about do I moderate, do I change things? Of course. I pull out the higher impact stuff. We don't do a lot of jumping, but we do power generation. So we do ladder drills, we do skipping, we do some easy lateral bounding as opposed to jumping over hurdles or implements where they could have an accidental fall or a thing of that nature. But we strength train just like we strength train anybody else, and we condition pretty hard on the bike. We push the sled just like I do our athletes.
Okay. Okay, we really are out of time, everybody. I appreciate everybody being here. Kevin, thanks so much for a great presentation. Lots of great comments. Somebody said it makes her miss being in class to learn more about kinesiology and exercise science. I like that.
Yeah, and if I'll just comment real quick, like I took just a couple of topics out of the book. There's a whole bunch more sections in the book that kind of dive into the entire training program, from mobility to power generation all the way through. So there's a lot more that's packed into that book if you haven't picked it up yet.
Yep. And as Kevin mentioned, the book is available on us.humankinetics.com and or everywhere great books are sold. So thanks everybody for being here, and look for more emails from us about future webinars. Thanks again, Kevin, for your time and your expertise.
Thank you.
All right.